Good afternoon. Welcome to Monday Reading Live. This is me, Vandana, joining you from Needu's Academy. Okay, so how was your weekend? Alright, so today we are going to learn about Part B as well as Part A. So first of all, I'll show you a sample question from Part B in the screen. Then you can do the question. Then we will discuss the answer. Okay, I'll give you 2 minutes for the question. And then we will discuss the answers. So let's look into the question. Alright, so the time is over. So what do you know about Part B? Okay, so first of all, let me tell you regarding the number of questions. Okay, so there are 6 questions in Part B, and we will get almost, I can say roughly 10 to 12 minutes for the completion of these 6 questions. Okay, and the 6 questions will be like in the form of multiple choice questions with 3 answer options. Okay, and the questions can be categorized into 3. So, can you say in which category this question falls under? Any idea? In which category the question falls under? So, I can say, what does this advisory intend to convey? So, there is a special purpose for this particular extract, so that it is completely related to the purpose, so that I can say it may be from the 3rd category, whether it is an email or a memo, or I can say notice. So as you can see here, there is no sender and receiver, so it's not an email or a memo. So this can be categorized into notice. And in a notice, we are reading for the purpose. Okay, so what is the purpose? So what does this advisory intend to convey? So my keywords, advisory, indents, convey. Okay, so that's all about the question. Coming back to the type of question. Yes, multiple choice questions with 3 answer options. So either you can read the question first, then read the options, and you can come to the paragraph, then you can do elimination strategy, then find out your answer. Otherwise, you can read the question, then read the paragraph, then come back to the options, eliminate, then find out your answer. So these are the 2 methods which you can do. Okay, so first of all, I'm just reading the question, then I'll read the options, then I'll go to the paragraph. So what does this advisory intend to convey? My keywords, advisory, indent, convey. Option A, the requirement for monitor of malnourished patients. So my keywords, requirement, monitor, malnourished. And from option B, primary route for providing external nutritional support. So the keywords, primary, then external, then support. And from option C, identification and management of malnourished patients. So my keywords, identification, management, and malnourished. Okay, so we are reading for the purpose. And as I was always saying, if it is an email or memo or notice, which lines are important? We can say always the last lines are important. I'm not saying that answer is in the last line, but 99% you will get that answer from the last lines. Okay, you'll get a lot of clue from the last line towards your answer. Okay, so let me read the paragraph. Step to contain malnourishment. Malnutrition is a state in which a deficiency of energy, protein, and or other nutrients causes measurable adverse effects on tissue or body form, composition, function, or clinical outcome. So that is all about what is malnutrition. Okay, then it is vital, it is important to identify patients at risk of malnutrition, as nutritional support is advantageous in malnourished patients. So from that line, let's trace to option A. We are identifying, monitoring the malnourished patients. Okay, so maybe it is option A, we have no idea. Then a nutritional screening tool can help identify the patient. A useful malnutrition, a universal screening tool has been developed by the malnutrition advisory group. So again, we can trace to option A as well as option B, because identification is mentioned here in option C, the first word. Then the rest of the lines. Enteral nutrition should be the first line route for the provision of nutritional support, and if the gut works, enteral feeding should be used. Okay, so what about the second para? It's all about the nutritional support, so which means we can trace to whether it is option B or option again C. So we have chances. Okay, so first of all, it is sure it's not about identification of the patient plus something else is mentioned in the paragraph. So what is it? So identification plus management, right? So if it is not option A, and we can also eliminate option B, because it is not about identification or it is not about management. It's all about both identification and management. So that we can select option C. That is the correct answer. Okay, identification and management of malnutrition or malnourished patients. So that is the correct answer. So how many of you got the correct answer? Okay. Yes, Jyoti, Adira, Abhi, Ammu, Reshma, okay, Biji, okay, yes, everyone got the correct answer. Very good. So now let's move to the second thing, that is part A. Okay, and the topic, we have another new topic, chylothorax. Okay, so a new topic. So yes, let's condense everything about part A. So what is part A? So what is the connection with part A and your day-to-day activities in a foreign hospital or a foreign country? Any idea what is the connection? Why we are reading part A? Why we are doing part A? So part A is all about locating particular thing from a particular, maybe for example, I can say a hard copy or a soft copy. Okay, we are locating the answers. We are locating something. So what is the connection with your day-to-day activities in a foreign country and doing part A? Okay, so suppose imagine this is your first day in a hospital, okay, and the doctor just wanted you to take a sample from the patient, and you guys have no idea how to take the sample. So what will you do? Okay, so what will you do? So you can do one thing, okay, whether you will ask your senior or you will ask the doctor itself, or you can document everything. So that is all about which can we relate with part B. So the first step is taking a sample from the patient. So for that you have to know the procedure. So if you don't know the procedure, what will you do? Okay, So if you have no idea how to locate that particular procedure from the hard copy, it will be very difficult for you to do this particular procedure. Okay, so that is how part A is related to your day-to-day life in your medical profession. Okay, so yes, part A, locating your answers. So how many questions in part A? We have 20 questions in part A. So what about the timing? What about the timing? Anyone know about the timing? Yes, you will get 15 minutes to do part A. And the rest of the time, which I can say 45 minutes, which is divided for part B and C. So it is 15 minutes for part A. Okay, and total 20 questions. So what about the strategy, the method we are using? So it is called elimination or elimination strategy or elimination method. That's for part B and C. And for part A, it's all about skimming and scanning. Okay, so 1 to 7 set of questions which can be called match the following, and 8 to 14 that can be called short answer questions, and the rest of the questions, which is 15 to 20, fill in the blanks. Okay, so it's all about locating your answers from this given 4 text. So we have text A, text B, text C, and text D. Each of the text will be different from one another, and one of the text will be a pictorial of something for sure. Okay, so maybe a diagram or a table, something else. So yes, so the first question, so yeah, before that, what is skimming and scanning? Okay, skimming and scanning. So what is skimming and scanning? So in a very simple words I can say, while you fast read these 4 texts, you can pick up some important ideas or important words from each of the text. That's called skimming and scanning in a very simple manner. Okay, so what are the keywords that you will mark? So that is the next step. Okay, so first of all, we have 13 important words. So the first one, all the headings. Second one, subheadings. What about the third one? It's all about the numbers. Fourth one, signs and symbols. Fifth one, all the names. I can say proper nouns. And the sixth one, abbreviations. Okay, then 7th one, all the brackets. Then 8th one, the words which is mentioned in italicized or bold letters. And 9th one, the words that indicate time. Then the words that indicate experiment, the words that indicate research, and then the next one gives special focus to the first and last line of each and every paragraph, as well as all the bullet points. So this is all about the 13 different key words that you can mark. Okay, it's all about, yes Jyoti, it's all about 15 minutes, skimming and scanning, yes, skimming and scanning, yes, fast reading. Okay, so the first question, so what is important information or instruction which is from match the following? Okay, so you can write it in a you can identify in which text that answer is from. Okay, yes, so the first one, the medications that are used to treat chylothorax. So what are the medications? Medications mentioned in which texts? So we are gonna locate that answers. Okay, I hope you have fast read each of the text. So now we are moving to the question answers. Okay, so for you, I'll just move to each of the text, then we will mark some keywords from the text. Okay, so first of all, yes, some words which is in brackets. Again, word of something, name of something, tissues, yes, blood cells. Then again the brackets. Okay, some name of the condition, injury, blockages. Then the pleural infusion. Okay, clinical history, words related to the experiment. Then numbers, signs and symbols. Okay, the words that indicate time. Again, name of the medicines or the name of the condition, protein. Okay, so these are my keywords from the text. Then comes signs and symptoms, each bullet points I'm just reading, fast reading. Okay, then text D, all the methods, bowel reset, draining fluid, somatostatin, and thoracic duct ligation, then pleurodesis. So these are the next ones. Okay, so everything we can mark like this, all the abbreviations. Okay, so IV, then okay, so these are the keywords from each of the text. Okay, so now we are moving to the first question, the medications that are used to treat Okay, 𝐂𝐤. So where is the answer mentioned? Any idea what are the medications that we are using? So which is from text D, a lot of procedures mentioned here for the management or the treatment. So from this we can identify in which point they have mentioned about the medications, and that is from text D. Yes, very good, correct answer. Okay, the third point, somatostatin or octreotide, which is these IV medications. So those are the keywords from the question. So I can say that is from text D. And the second one, when one has to use alternative etiologies for 𝐂𝐤. So what are the alternative etiologies for 𝐂𝐤? My keywords, etiologies in 𝐂𝐤. So yes, what is the answer? Okay, Jansi, yes, Tessie. Hi Soumya, how are you? Yes. Okay. Then Yogeshwari, Ammu, Biji, Reshma, Binsi, GN, okay. Everyone got the correct answer. Excellent, it is option D. Yes, what about the second one? Yes, Reshma, Tessie, Ammu, okay, Jansi. It is text B. Okay, text B. Yes, Tensin. Yes, so happy to see you here. Okay, Anu, yes, Binsi. Okay, text B. Very good, that is from text B. So where is it mentioned? As you can see here, from text B, okay, so the exposure alternative etiology. So those are the keywords, alternative plus etiology. So my answer is from text B. Yes. Next one, why do people with 𝐂𝐤 succumb to malnutrition? So my keywords, malnutrition and 𝐂𝐤. So what is your answer for the third question? Why do people with 𝐂𝐤 succumb to malnutrition? So okay, malnutrition, which is mentioned in the signs and symptoms, that is from text C. See the third point, malnutrition due to the loss of protein, fats and vitamins, weight loss and muscle wasting. So our answer is here, which is in part C, text C. Okay, so the answer should be text C. Fourth one, what factors increase the chance of occurring 𝐂𝐤? So what are the factors that can increase the chance of this condition? Okay, so everything about the disease condition is mentioned in text A. So as you can see here, what are the chances? So you might be at higher risk of 𝐂𝐤 if you have these factors or if you have these conditions, following conditions. So our answer is from text A. So yes, that is from text A. Okay, very good. Okay, Tessie, you got the correct answer. What about others? Okay, Benny, yeah, that is from text C. Your answer is absolutely correct. Anu, okay, GN, okay. Okay, so fourth one, that is from text A. Then we are jumping to the fifth question. How do we trace the presence of isolated 𝐂𝐤? So my keywords, isolated, trace and 𝐂𝐤. Okay, so what is your answer? How do we understand? So that is through understanding the procedures, right? Okay, so which is from text B. As you can see here, isolated 𝐂𝐤. So this is the procedure. So this is the method, which is all about this diagram. So answer should be from text B. Yeah. Sixth one, which are important components consisting in child? So important components child. So my answer will be from text A. So where is it mentioned in text A? It's all about chyle. So chyle is a kind of lymph that comes from your digestive tract. So that's all about chyle, which is from text A, the second para. It's all about the chyle. Okay, then the last one, common surgical interventions to manage 𝐂𝐤. So what are the management? It's all about surgical interventions to manage the situation. So management, which is from text D. So what are the managements? Okay, so it's all about the surgical procedure, which comes from this particular procedure, thoracic duct ligation and embolization. Okay, as well as the second one also, surgical procedure. So these are the keywords, right? So which is from text D. Okay, seventh one D. Yes, Vidya, very good. Okay, so now that's the end of match the following questions. Now let's move to short answers. So what is the important instruction here? Okay, so you can write it in a word or a short phrase. So what do you mean by word? Now you know what is a word. So short phrase, which means, yeah, okay, short phrase which means maximum of 3 words. Phrase which means number of or combination of different words, and short phrase which means maximum of 3 words. Okay, so the first question, a procedure that is done to avoid, okay, control the space inside the chest in order to prevent the accumulation of fluid there. Okay, Benny, it's all about 3 words. Yes, very good. Yeah, so what is your answer for the 8th question? Did you got the answer? 8th one, a procedure. What procedure? Okay, so the procedures, as you know, which is mentioned in text D, and what are the keywords? Okay, so surgical procedure, then they have mentioned about the space inside your chest, so answer should be pleurodesis. Okay, pleurodesis is a surgical procedure that sticks your lungs to the lining on the inside of your chest wall. This gets rid of the space inside your chest where the fluid is collecting. So answer should be from text D. Pleurodesis should be the answer. Okay, so the 9th one, the presence of which condition? So we need the answer to which condition, okay, can be confirmed with the level of triglyceride over 110 mg per dl. So yes, the measurement, then triglyceride, and the name of the condition we need. Which condition? So what condition? Okay, so the condition that can be called, so what is the condition? Yes, chylothorax should be the condition. Yes, Hannah, very good. So that is your answer. Yes, that is the correct answer. Answer should be chylothorax. From, it's not from text A, which is from text, okay, B here. So that particular measurement is mentioned here, 110 mg per dl. It can be connected with chylothorax. Okay, yeah, so that is the answer. Then 10th one, who patrol the lymph to look for and destroy germs like bacteria and viruses? So yes, so who patrol? Who will take care of that? So yes, that lymph as well as germs like bacteria, viruses. So answer should be, okay, Anna, Tessie, Benny, Vidya. Yes, it is chylothorax. What about 10th one? 10th question? Any idea? Okay, so 10th one, who will take care of? Okay, so that is text A, which is mentioned here. The white blood cells, there is a mistake here, okay, it's not vessels, it is cells. White blood cells patrol the fluid lymph to look for and destroy germs like bacteria and viruses. So answer should be white blood cells. Okay, then 11th one, which sign? We need a sign or a symptom. Which sign might be hardly present in people with chylothorax due to bacteriostatic nature of lecithin and fatty acids? So what is your answer? Which sign? Yes, I know, right answer, it is white blood cells. Yes, dear. So what about 11th one? Which sign? Okay, which sign? So that is, it should be from which signs and symptoms? Which sign? Answer should be emphysema is a rare condition or rare due to bacteriostatic nature of the things. Okay, lecithin or fatty acid. So answer should be emphysema. Okay, again direct answer. Then 12th one, the procedure. So again we need the name of the procedure. Usually executes to drain fluid from the chest. So what is your answer? The name of the procedure. So which procedure? Okay, very good. Yes, correct answer. Yes, everyone. Okay, Reshma, Ashwati, Benny, Tessie, very good. Excellent. Jansi. Okay, coaches. Yes, excellent. Okay, so what about 12th one? The procedure. Name of the procedure that usually executes to drain the fluid from the chest. So what is your answer? Okay, thoracentesis. Very good, Preeta. Tessie, yes. Thoracentesis should be the answer. So where is it mentioned? It is mentioned in text D. Okay. So where is it mentioned in text D? The answer, your answer. So draining fluid, that is one of the keyword from the question. So what is the method? That is the question. So a provider may drain the fluid from your chest using this particular procedure. What particular procedure? Thoracentesis. So answer should be thoracentesis. 13th one. What might have to be obtained if the triglyceride is less than 110 mg per dl? Less than. Okay, if the triglyceride is less than this much amount. Okay, so yes, what is your answer? Okay, so which is mentioned here. So where is it mentioned? So that answer should be from the table. Okay, sorry, not from the table, from the chart. If it is less than 100 mg per dl, then we will obtain what? It is plural chylomicrons. So answer should be plural chylomicrons. Okay, then 13, the last one, the source of chyle. The source of chyle. So where is it mentioned? The origin. Where is the origin of chyle? Okay, so everything is mentioned here. The chyle is a kind of lymph that comes from, so where is the origin? Digestive tracts. Okay, so that is digestive tract. So what is the question? Question is asking you regarding the source of chyle, and that is from digestive tract. Text A. So end of this next one, short answer question. So we are moving to the next one. Fill in the blanks. 15th one. If your dash is damaged or doesn't work properly, a provider may surgically tie it off, ligation or embolization. So where these keywords mentioned, ligation, embolization. So as you can see here, which is mentioned in text D, it's all about thoracic duct. So ligation as well as embolization is already mentioned in the question, so you don't have to write it. Answer should be thoracic duct is damaged or doesn't work properly. So answer should be thoracic duct. Okay. Okay, I know digestive tract actually. Okay, that is 14th one, right? Yes. Okay, Benny, Ashwati, yes, GN, Hannah, okay, Tessie. Yeah, very good. Then moving to the next one, 16th. Dash is a kind of lymph that comes from your digestive tract, contains a mix of white blood cells and fats that make it look milky. So what is your answer? Dash kind of. Okay, so which is question number 16. As you can see here from text A, see the second paragraph. Okay, chyle is a kind of lymph that comes from your digestive tract. It contains a mix of white blood cells and fats that make it look milky. So answer should be chyle. Chyle. Yes. Okay, so 17th. Okay, Soumya. Yes. Jansi. Okay. Okay, Ashwati, Anu, Tessie, Tenzin. Okay, Preeta. Oh, a lot of answers. Hanna, Reshma. Okay. Okay, 17th one. In order to provide test for dash that transport chyle, the provider will give you all of your nutrition through your IV. So IV, which is mentioned in text D. So the answer should be from, okay, so where is it mentioned? What is your answer? Any idea? Answer should be lymph cells. Okay, so this is our question. In order to provide test for dash that transport chyle, the provider will give you all of the nutrition through IV. 17th one. So answer should be, it is mentioned in text D. Okay, so bowel rest. Your lymph vessels that transport chyle may need a break so they can heal. To do this, your provider will give you all of your nutrition through an IV. This gives your body a rest from breaking down food through your digestive system. So what is your answer? Any idea? What is your answer? Answer should be lymph cells, not lymph vessels. Again, there is a mistake. It is lymph cells, lymph cells. Okay, 18th one. Dash is due to the loss of proteins, fats and vitamins that can be noticed in patients with chylothorax. So dash is due to. What is due to? Okay, so yes, because it is from the signs and symptoms. Okay, so loss of protein, fats, vitamins, it's due to malnutrition. So answer should be malnutrition. Okay, then the second last one, you might be at higher risk of chylothorax if you had recent surgery to test your chest, neck or dash. Of what? 19th one. So that is from text A. Okay. So what is the point mentioned here? Had recent surgery to your chest, neck or abdomen. So what is the missing word? It should be abdomen from text A. So answer should be abdomen. Okay, Prida, Hannah, very good. It is abdomen. The last one. We need to obtain dash if the pleural effusion with milky fluid appearance is noticed in the test. So what is the answer? What is the missing word there? Okay, so answer should be from text B. Okay, so that is mentioned here, pleural fluid triglycerides. It should be the answer. Answer should be pleural fluid triglycerides. Okay, so that is the correct answer. Okay, so any doubts regarding any of the questions? No doubts. Okay, so we have done with this material. If you have any doubts or concerns, you can comment. While attending the session, I mean during the session or after the session, maybe you'll get a lot of messages from fraudulent people. So don't reply to those messages. Okay. And as I was always saying, if you have any doubts regarding the sessions, classes or anything, you can contact us on the number which is mentioned on the screen. Okay. So thank you for today and stay tuned for tomorrow.